Hello, my name is Ethan Tennant, and today I'll be covering the controversial ethical dilemma of assisted suicides. The Act on Decisions on Life-Sustaining Treatment was implemented in Korea in February of 2018, allowing terminally ill individuals to withdraw life-sustaining medical care in accordance with their own will. The idea of physician-aided suicide has been hotly debated since at least the 90s and has ushered in conversation regarding those even healthy expressing their intentions to withhold life-sustaining medical care. This conversation has in turn resulted in emotionally charged debates on the ethics of this matter. The general public, the press, and even some academic literatures are using the termination of life-sustaining care and death with dignity as synonyms. Many feel that confronting death with the assistance of a trained professional is well dying or this dying with dignity. Others, however, feel as though that the removal of medical care would only do more harm than good. Given the divisive nature of this topic, it is important to consider all the potential consequences of what assisted suicide could produce for our modern-day society and therefore future generations. I will be providing both sides of the argument as well as cited text to further our understanding of the matter. To continue, the American Medical Association Code of Medical Ethics, or AMA, is not in support of physician participation in assisted suicide, calling the practice fundamentally incompatible with the physician's role as a healer. The job of the American Medical Association, AMA, Code of Medical Ethics is to articulate core professional values while building trust between patients and physicians. AMA provides practical guidance for daily practice, encouraging the practice of honorable behavior. AMA feels alternative care that aims at reducing patients' physical and emotional pain should be practiced as opposed to assisted death. AMA also feels there to be immense societal risk as trust between the public and medical professionals could weaken. I pulled all this information from the Code of Medical Ethics directly. AMA suggests that instead of an assisted suicide, a physician should not abandon a patient once it's determined a cure is impossible, must respect autonomy, must provide emotional support and good communication, and finally must provide appropriate comfort, care, and adequate pain control. AMA and a percentage of the general public still feel medical assisted suicide would only produce more harm than good, highlighting the idea that a decisive answer is not yet clear. To continue, about 6 in 10 Americans do not have a moral objection to medical assisted suicide. New York and Illinois recently joined 11 other states and the District of Columbia in allowing people with serious illnesses to end their lives via a doctor's help. Furthermore, 34% of Americans feel that a patient choosing to end their lives with medical assistance is morally acceptable, while 29% say it's not a moral issue at all. I pulled this information from a source titled "About 6 in 10 Americans Do Not Have Moral Objections to Medical Aid in Dying." Furthermore, Oregon was one of the first states to pass a death with dignity bill, allowing terminally ill patients more control over their fate. Within the last 16 years, overall tolerance for the idea of medical-assisted suicide has increased, as a survey from 2010 found that more than 21,000 medical professionals found that the majority of the doctors surveyed, 54%, favored a patient's right to physician aid in dying. There appears to be a disconnect between AMA and the practicing physician's stance on assisted suicide, given that the majority of the doctors surveyed are in favor. Those suffering terminal illnesses have to deal with both physical and mental torture, stripped of any strength and power they have left. The idea of a medical-assisted suicide would allow these patients to have more control over their outcomes, ending that suffering. I pulled the last bit of data from a study done at Harvard titled Choosing Death Over Suffering. Finally, I applied a non-consequential ethical theory of Kantian ethics. I listed my 4 options. I applied universality to all 4 options, and they are as followed. Banning assisted suicides completely, banning assisted suicides for those not terminally ill, allowing assisted suicides for those only terminally ill, or allowing assisted suicides for anyone over 18 with the clearance of medical professionals, a judgment call. When applying universality, only 2 met the requirement. Those 2 are banning assisted suicides for those not terminally ill, and allowing assisted suicides for those only terminally ill. From there, I applied respect for persons, which only 1 met the requirement, which was allowing assisted suicides for those only terminally ill. This meets both universality and respect for persons, and this is the conclusion I have decided to be the best fit for our ethical dilemma. Allowing assisted suicides for those only terminally ill allows those suffering to take back control and brings immense comfort to the families suffering as well. I believe that to conclude my presentation. Thank you very much.